see here. All right, just a couple conflicts to begin. Some of the groups that I'm affiliated with or have received dollars to do research that won't impact what I tell you today. I'm going to keep it pretty basic and hopefully give you some application as well. So one thing to think about before we, jump into some recommendations is to recognize that there are physiological differences between males and females, largely driven by hormones, but in reality, it impacts every system in our body. So brain, cognition, focus, cardiovascular health, and some of these change obviously across the menstrual cycle, but then also with age. Endocrine and inflammatory markers are particularly different across the menstrual cycle and as women transition to menopause, metabolic differences, GI differences, and then performance and recovery. So I just want to make space real quick for this idea. Right now, it's this popular, idea that we would switch and change our exercise training across the menstrual cycle, when in reality, you should change recovery based on our physiological outcomes. But in reality, nutrition is what should be changing across the menstrual cycle to help with some of these lower aspects of recovery or greater inflammation, which I'll talk about that. Like, what are some nutritional strategies that might help with the key changes? And then, we only have so much time today, so I'll briefly give you some thoughts regarding pregnancy and perimenopause. But really identifying if you are dealing with someone or even you yourself, any aspects related to these systems, then there largely are different approaches nutritionally that could tackle these. So when we look across the transition to menopause for women, there's some key life stages to think about, things that we might want to do differently strategically for nutrition. In our pre-menopause, and this really starts more, at the time puberty, so 12 and above, but a lot of the changes really happen at 18. Differences in muscle growth, bone development, heart rate, blood pressure, painful periods happen in really more than 70% of women, and inflammation. So a lot of this can be targeted with nutrition. And then when we look across the lifespan, there's significant changes in health and aspects to body composition that can be dealt with particularly earlier in this mid-40s. So the average onset of perimenopause is actually 42, and average onset of postmenopause is 52. So thinking, if you deal with a woman between the age of 42 and 52, there's dramatic nutritional things that we can do to support their lifelong health. I think related to bone and muscle, which I'll talk about here in a little bit. So here are the things I'm going to target pretty quickly, hopefully leaving time for questions as well. So pre-menopause, there's some key stages, and I'm going to talk about a normal menstrual cycle, but recognizing that many women do not have a normal menstrual cycle, and even more people, particularly in the US, are using some form of hormonal contraception. So their phase would look quite different. But when we think about it, we have this follicular phase, which is more of a low hormone phase, our ovulatory phase, and then our luteal phase. And some key takeaways here. In the follicular phase, down here is phase 1. That's actually during menses. In early follicular, we see a greater increase in carbohydrate utilization. There's some research that shows there's greater inflammation, but that could go hand in hand as there's an increase in pain tolerance, so potentially greater volume. And then I loved the talk by Dr. Tartar about sleep. There's kind of differing advice and literature about when sleep is poor. Some thought is that during this menstrual phase, during bleeding, sleep is downregulated, but then also during the luteal phase. During ovulation, which only lasts a couple of days, is usually when women are feeling their best. And then the luteal phase is where we see a lot of potential for nutritional support. So in this phase, we see an increase in energy expenditure by a couple hundred calories. Also, some new data, we are working on a paper that shows some greater protein oxidation, which may start to impact more specific protein recommendations for women, greater fat oxidation. We also see this increase in fluid retention. So this is often times when women are feeling, a little bit heavier. They may have gained a couple pounds, but it's also a lot more edema. So fluid sitting on the extracellular side, and greater risk for dehydration. So when we think about this phase, because women are not feeling their best, they have gained a couple pounds, they're often calorically restricting. but their energy expenditure is high. So this phase, we see these longer phases of recovery, when in reality, we could just feed a little bit higher, greater protein, and I would argue carbohydrate intake to help with this. And I'll show you a couple other specific strategies here. So based on that, some other things to consider in the follicular phase is increasing complex carbohydrate to allow for greater blood glucose to prevent some of that, hypoglycemia, because carbohydrate is the main fuel in the follicular phase. Obviously, carbohydrate is the main fuel if you're doing high intensity exercise, but just being cognizant of that, as carbohydrate intake is quite low in most women. Because of that increased inflammatory response here, whether it's from greater volume or just inflammation in general, omega-3 is a great way to target that naturally. And the nutrient timing in general for females, the research, particularly coming out of our labs that we've tried to identify, is that nutrient timing, particularly pre-exercise, might be more advantageous for women than some of the traditional post-exercise. And then there's some research thinking, because of the sleep phase here, you might want to avoid caffeine in these early days of the follicular phase, but also because to make it more effective in the luteal phase. So luteal, I'll show you a piece of data here in a moment. So in the luteal phase, a couple things to consider is maybe adding a snack or pre-bed feeding to help with that recovery and prevention of protein breakdown. Really enhancing the type of protein, so our essentials and whey, to maximize absorption. There's some new data that shows that caffeine can help prevent some of the performance losses that are seen in the luteal phase. So sometimes exercise performance and outcomes are slightly downregulated or reduced in that luteal phase, so caffeine might help return that. And then we finished a couple studies looking at creatine across different phases of the menstrual cycle, and really showed that if you load in creatine, or if you're loaded with creatine running into the luteal phase, it may prevent some of those performance decreases, but also help with that fluid element I mentioned. It can bring fluid from that extracellular space intracellularly. So that not only helps with that edema, but also potentially with dehydration. And then I did see Dr. Stout just jump on, but with the idea of beta-alanine, particularly as women age, we also lose muscle. And there's some early data that suggests that beta-alanine might be more effective even for women as they age, because of the loss of muscle. And based on all of the elements of beta-alanine related to fatigue, having those kind of that loading phase going into the luteal phase can help with that recovery. The other thing I wanted to mention, one of the most important things with female and really just active women, is sufficient caloric intake. And we know, so much of the research for the last several decades has been specifically related to RED-S and the female athlete triad. But I wanted to highlight is that if you have anyone dealing, a female specifically, with GI or immune system issues, most often it's related to low energy intake. And so getting some aspect of caloric intake and energy expenditure in this measure of fat-free mass can be your first line of defense, particularly for a female athlete. Now, low energy availability does happen in males, but they are a bit more resilient. So these early symptoms, particularly of GI distress, would be something to tackle. And then I also wanted to share, again, the common experiences of women of painful periods. It's very common, particularly one of the main reasons women use hormonal contraception. And there's some nutritional strategies that have been reported in the literature to potentially help. So here, if we look down 7 to 10 days prior to menstrual bleeding, so in that premenstrual phase would be the luteal phase, adding omega-3 and magnesium and potentially some aspirin can be a way to help with those PMS symptoms. And just to make note too, zinc and magnesium also help with sleep, and women are at a greater risk for being low in magnesium. So these are some kind of easy ways opposed to taking heavy doses of ibuprofen. And then I wanted to share just this nutrient timing piece, because women so often calorically restrict or, are following these fasted cardio and exercise guidelines. Really what we've identified in a few studies and are trying to dive in a little bit more is that it seems that pre-exercise nutrient timing may be more appropriate. And this is just one of the studies I wanted to highlight, that looking at a pre-exercise intake of protein versus post versus nothing at all, training volume was significantly lower in post, which impacted the changes in body composition and strength. So in reality, and it also impacted metabolism. So many times people try and do fasted exercise because they think it will cause greater fat oxidation, when in reality, a growing body of research shows that it actually blunts fat oxidation. So here, not only are we seeing a greater increase in lean mass, loss of fat mass, but also significantly greater increases in strength by just having a meal, or in most of the studies that we've looked at, is just 25 grams of protein pre-exercise. And then this is I wanted you all to have some of the data of how applying some of the same concepts we have about, caffeine, which we've studied for decades, but just recently started to look at, may it work differently for females? This is the study that really demonstrated caffeine can help mitigate some of the performance decrements that we see in the luteal phase. So this goes back to this idea of, do we need to change our training across the menstrual cycle? I would say, you never want to, prevent someone from exercising during different phases of the menstrual cycle. But yeah, there's times that a woman might not feel at her best. Caffeine may be a strategy to help her feel better. Creatine is another one. I just saw Darren pop on his camera. I won't steal his thunder, but I just wanted to make space that creatine monohydrate will not increase body weight. In this particular study, and this for years, we have not seen it in women, but this one in particular that we finished in our lab, women gained 0.5 pound of body weight in the luteal phase with creatine loading. And we saw the significant improvements in total body water in all levels of intracellular and extracellular fluid, particularly in the luteal phase. And then I'll just make note too, we saw improvements in performance, again, in the luteal phase. So creatine may also be one of those strategies, maybe the next study is to look at combining creatine and caffeine to see how that looks across the menstrual cycle. So here's just a practical example of what this all might look like, and what you might do considering the phase of the cycle. Like I said, I don't think we should change our training. You might need to change some volume, some rest periods, but absolutely your nutrition, changing our macronutrients, our caloric intake, and our dietary supplements. I'll come back to this in a second. So then pregnancy, so everyone always asks this question, and there's not a lot of great data, but there is good theoretical data. And so I wanted you all to have some quick takeaways. So I will just tell you, giving birth may be the most athletic event that you do in your life. And I can say that because I've been a collegiate athlete and had 2 babies. And I say that because we should really think about our bodies as training for this event. You should exercise and train those muscles. You should also think about your nutrition. So the growth and development, the side effects, things like constipation can be tackled nutritionally, and nutrient timing. So going into birth, like going into the delivery room, you should pack the things that you would eat for a competition. And so when we look at some of those things outside of the birth itself, I know Darren might touch on this, but I wanted to give you some resources and to tell you, creatine supplementation during pregnancy and postpartum, has some growing data. And when you think about it, it would be very similar to me eating an additional 6 chicken breasts throughout the throughout the pregnancy, which is hard to do, especially as you run out of space. And just highlighting the improvements in cognition, especially under sleep deprivation. So the postpartum period can be really important, as well as in the fetus. So there's growing data out of Australia that suggests that some of the hypoxia that you see with labor and delivery, it can prevent some of those negative side effects. And then I just wanted to put this note of bone. So women are at the greatest risk for losing bone mineral density as they transition to menopause, with a lot of it happening in perimenopause. And Darren's group has, the largest study that shows creatine combined with resistance training can increase bone. If we have women do that during pregnancy, that's often too where they lose a lot of bone density because of the growing human. And so creatine supplementation during pregnancy and postpartum can actually be very advantageous for the mom and the child. Probiotics is another kind of missing thing. It is really strain specific, so I wanted to share this specific chart. One thing they don't tell you is they make you go to the bathroom before you leave the hospital, yet depending on your approach to delivery, that can be hard to do. And so having a probiotic with you and some, dietary supplements like a fiber supplement can really help that process postpartum. And then I also wanted to make note that the GI distress in women is much higher than men. And having a female-specific probiotic can be really helpful. So this you can refer back to. So for example, if you are dealing with IBS, many of these things you can't just get with yogurt. It has to be strain-specific, and looking at that, again, kind of during pregnancy, postpartum, as well as just as that transition to menopause. So here's just a couple of takeaways of what I would recommend. So preconception, reducing caffeine, adding some sort of prenatal vitamin, and then starting in the first trimester, adding a high quality omega-3 to help with brain development, an amino acid complex. I put this here because oftentimes appetite and nausea, appetite is low, nausea is high. So a high quality amino acid can help with that growth and development. Continuing that omega-3 kind of higher doses through brain development, adding in creatine. Obviously, it's safe throughout all phases of pregnancy, but something to consider second trimester and on as we think about kind of skeletal growth. And then adding that probiotic in third trimester, and then moving into the fourth trimester, so postpartum, continuing that multivitamin, probiotic, protein powder, omega-3, and keeping that protein intake high postpartum. And hydration. So hydration is a key element, particularly for females, that you might want to consider. So you see that summary there. I'm going to move on to the next so that we have a little time for questions. Just a couple ideas here with perimenopause. So our group and others have really shown there's a significant increase in body fat, but more so driven by a drop in lean mass in perimenopause. So if you can think about what nutritional and exercise strategies can target and prevent a loss of muscle, that may support these kind of negative metabolic changes that we see in perimenopause. And so we also see a loss of protein turnover, likely a greater increase in protein kind of anabolic resistance in perimenopause. So modifying that with diet might be particularly helpful. Other things to think about, and this is true for most people, but even more important during perimenopause, is increasing antioxidants, complex carbohydrates. We see this increase in diabetes, metabolic syndrome, greater anabolic resistance, so increasing protein intake and targeting inflammation with high quality omega-3s. Nootropic, so there are significant brain changes for women across the perimenopause, and these are some natural ways to target that. So I wanted to give you some ideas here with some doses of key nootropics that might help with cognition and focus. And then another slide here just to show you there are a lot of growing things that seem to support depending on what the symptom is. So for example, we see increases in or reduces in cognition and focus, but also increases in depression and trouble sleeping. So these are some other things to think about depending on each of the females' kind of troubles. And then lastly, here's your takeaway of what I might do for a perimenopausal woman is increase higher doses of protein throughout the day, definitely maximize that nutrient timing, a couple nutritional dietary supplements to consider for this group, and also that pre-bed feeding and some dietary supplements. So magnesium is really the only one I haven't talked about, and vitamin D. Those become even more important for our perimenopause group. So don't forget to lift heavy weights, and also just making this last note of prioritizing you. Most women in this space are taking care of others and not prioritizing their nutrition, which can be really advantageous if they do prioritize that. And then here's my just general takeaways. And I think I have a couple minutes for questions. I did start late, so I wanted to make space to make sure that we did have time for questions.
Abbie, that was a great presentation. I'm personally curious about the caffeine during pregnancy issue. I'm not familiar with the data. Could you comment on, is it caffeine or is it coffee or is it both? Or what's the data say?
Yeah, it's kind of interesting. So honestly, I think sometimes the mass data changes because of women complain too much. I mean, that's a lot to deal without caffeine, but there is a little data to suggest that caffeine may impact fertility, so the ability to get pregnant. And then whatever you consume as the mother, like growing a fetus, it hits the fetus. So they usually it's less than, recommend consuming less than 1 cup. So obviously that's depending on how it's brewed per day across the kind of the gestation.
But it's the caffeine, not the coffee.
Right. It's the caffeine. Yeah. So decaf coffee, I mean, we know there's a lot of benefits from coffee. Yeah.
Okay. Another question from the audience is, are HIIT style workouts specifically beneficial for those in peri or perimenopause or menopause? Doing HIIT training?
Yeah, I would say both. So here's the thing, and my lab studies a lot of high intensity interval training, and it tends to support greater fat oxidation, greater energy expenditure, as well as support muscle mass, which is hard to do. And so we really want to maximize muscle, but there's a number of metabolic changes that are happening. And so HIIT tends to do that, whereas a lot of times resistance training doesn't. So those mitochondrial changes can be really advantageous for health. And it's low volume. So we see kind of a greater bang, while we also see increased musculoskeletal pain in some other methods.